I work in the healthcare industry, and it's our data is on lockdown, right? Whenever we run a query, they know about it. Some compliance officer will know about it, and it has to be because we're making an oath. We're legally bound to keep the patient's data absolutely private, absolutely secret, and it's never going to be breached. So it's very important to do that. But like you say, research has to continue, especially scientific research has to be allowed to see some extent this data, right? Otherwise, there's going to be very little advances. The financial industry and the advertising industry are light years ahead in terms of technology, in terms of data mining, than the healthcare industry. So the healthcare industry has a way to reach to get into that, the levels of the Googles and the Amazons and Wall Street, right? We have it's a long road to get there. So that's one challenge. We're trying to get there. There's a lot of big data challenges. We have huge amounts of data. We're barely scratching the surface. We're trying to do a lot of natural language processing on a large scale at Providence, but we're really the first ones doing it. Well, I can guarantee you that Google and Facebook and Amazon, they know everything that everybody's posting, right? They're so advanced. We're actually using open source technology from Google in a project I'm working on right now, because their tools are light years ahead of anything else that we have. And thank you, Google, for sharing it and making it open source, really. So they have a challenge. They need to catch up to all the other for-profit industries out there. So that's one of the challenge. And the other one, and you mentioned that before, is the PHI, the protected healthcare information. It's a huge deal. It's everything we do, we have to make sure we're not violating patient information and patient trust. So in terms of big data, it's almost contradictory, right? You have privacy and big data, and people take their healthcare insurance, healthcare data very seriously, right? You don't want to be violating their trust on that. So those are huge hurdles, and that I think maybe one of the reasons why the healthcare industry is not as advanced as Google or Facebook, because they have a lot more rights on the data, right?